Did you know that poor sleep can be one of the biggest reasons and one of the most underestimated cause of why women struggle to lose fat? Hi, I'm Dr. Dishika, and here are some science-based facts as to why poor sleep impacts your fat loss, especially as a woman. So, I want you to think about the last night of sleep deprivation that you had. If you felt foggy, irritable, hungry for no reason, and you just reached out to something sweet or heavy without even having a chance to register or think about it, it is not a lack of your willpower or your discipline. It is actually your hormones, and they're trying to tell you something here. Here's what's happening. The two most important hormones called ghrelin and leptin are directly impacted after a poor night of sleep. So ghrelin is your hunger hormone, which goes up, and leptin, which is the satiety hormone, goes down. And when there's a mismatch between these two hormones, you feel hungrier without reason and start making irrational decisions when it comes to food. But it also goes deeper. If poor sleep is something which is a constant pattern in your life, it elevates your cortisol chronically, and elevated cortisol also drives hunger. It makes your insulin resistance worse, and it directly impacts your hormones in the long term, especially if you are somebody who has PCOS or PCOS like symptoms. Elevated cortisol and disrupted sleep patterns go hand in hand. You can have the best nutrition plan or the best training plan in the world, but if you're not sleeping well enough, none of this is actually going to work in the long term. Fat loss doesn't alone happen in the gym or at the dining table. A huge chunk of it also happens in the bedroom, where you're allowing yourself to rest, recover, and let your hormones do the work that they're meant to do. So do not overlook sleep, especially when you are wanting to lose fat while balancing your hormones.